stressed, it is important that we prevent imported cases and revival of domestic cases. Be cautious and be pragmatic and down-to-earth in all the specific jobs. Premier Li Keqiang put forward very clarified requirements. Emergency responses must be combined with regular efforts, and we need to timely optimize the preventative measures. Today, we will focus on the prevention control of COVID-19 and international cooperation on the medical front. We have with us Inspector Wang Bin from the Disease Control Bureau of National Health Commission, Inspector Li Mingzhu from the International Cooperation Department of National Health Commission, Chief Epidemiologist Mr. Wu Zhunyou from CDC, Researcher Feng Luzhao from CDC, to share with us opinions and take questions on homestay observation, epidemiological survey, and international cooperation on medical fronts. Some updates on the pandemic in the 24 hours of April the 1st. Provinces, municipalities, cities, and Xinjiang Production Construction Corp reported new confirmed cases 35, new suspected cases 20. All were imported cases. New deaths 6. All were Hubei cases. On the day, newly cured and discharged from hospitals 117. Those of medical observation, 1,898 severe cases were reduced by 37. About imported cases, remaining confirmed imported cases 701, including 18 severe cases. Remaining imported suspected cases 152. Cumulatively confirmed imported cases 841. Cumulatively cured and discharged from hospitals 140. There was no death case. As of 24 o'clock April the 1st, provinces, cities, and Xinjiang Production Construction Corp reported remaining confirmed cases 1,863, including 429 severe cases. Remaining suspected cases 153. Cumulatively confirmed cases 81,589. Cumulatively cured and discharged from hospitals 76,408. Cumulative deaths 3,318. Cumulatively traced close contacts numbered 709,570. Those who remain under medical observation as close contacts 20,072. In Hubei province, there was no new confirmed case, no new suspected cases, no remaining suspected cases on the day. Newly cured and discharged from hospitals 145. All were Wuhan cases. New deaths 6. All were Wuhan cases. Remaining confirmed cases in the province 1,132, including 1,128 in Wuhan, among which 400 were severe cases, including 397 severe cases in Wuhan. Cumulatively cured and discharged from hospitals 63,471, including 46,320 in Wuhan. Cumulative deaths 3,199, including 2,559 in Wuhan. Cumulatively confirmed cases 67,802, including 50,007 in Wuhan. Provinces, municipalities, and Xinjiang Production and Construction Corp reported new asymptomatic cases 55, including 17 imported cases on the day. 9 were confirmed. All were imported cases on the day. 330 8 were off medical observation, among which 12 were imported cases. Asymptomatic cases under medical observation 1,075, including 226 imported asymptomatic cases from Hong Kong, Macau, and Taiwan. Cumulatively reported confirmed cases 1,135, including 765 in the Hong Kong SAR, 41 in the Macau SAR, and 329 in the Taiwan region. On April the 1st, in 9 provinces, Xinjiang Production and Construction Corp, there was no domestic new confirmed suspected cases, no close contact since 12th of March. The daily domestic new confirmed case were below 5 cases. As of April the 1st, 26 provinces have reported imported confirmed cases from 47 countries. It is important that we step up community management and the screening of the cases. Prevention measures should be done to individual households and individuals. This has been the updates of the pandemic. Now the floor is open for questions. Please ask your questions on today's topic, and please identify yourself before you ask your question. Journalist from the first row on the right side with Shenzhen Satellite TV. I have a question on epidemiological survey. We know a key for prevention control are the 4 earlies for the identification, reporting, quarantine, and treatment. So what has been the role of epidemiological survey in early identification? Despite of our achievements, there is still arduous challenge to the epidemiological survey. What will be the next step focus? I'd like to ask Inspector Wang Bin to take the question. Thank you for your question. It is fair to say that epidemiological survey has been the measure adopted according to infectious disease prevention and control law and emergency response regulations. It is one of the baseline efforts that we make. Epidemiological survey is the call for early identification of cases. Disease control staff will look at confirmed cases, suspected cases, asymptomatic cases, and cluster cases. It refers to on-site survey and inspection. It is based on face-to-face communication with the cases and the patients, make inquiry into their exposure around the onset and their contacts with others, and learn about their activity traces, their seeking of medical treatment. Based on this communication, we can have a scientific analysis on the close contacts of the suspected cases or confirmed cases. The knowledge of the potential close contacts will lead us to a timely tracing of close contacts and make early quarantine and interventions as necessary to effectively control the source of transmission, cut off transmission, and realize early identification and early reporting. China is faced with mounting pressure of preventing imported cases. To implement well the strategies in preventing importation and domestic recurrence, we have the following focuses. First, for the imported, confirmed, and suspected cases, imported cases with fever and other symptoms, and their potential close contacts must be put under epidemiological survey. Second, health institutions, communities, and households may identify confirmed, suspected, and asymptomatic cases and cluster cases. Is also a focus. And second focus is on the businesses who are resuming operation, schools and kindergartens who are reopened. Epidemiological survey is also conducted in these areas. And the next focus is the epidemiological survey done in the nursing homes for the old-aged. abnormal situations are also put under epidemiological survey.
提问。
Thank you. Let's continue. On the left, on the front row, the first lady reporter, please. Thank you. With CCTV, my question is, now the pandemic is spreading to more than 200 countries and regions in the world, gravely affecting the economic and the social development. Now it needs the joint efforts of the international community. In the extraordinary Leaders Summit of G20, President Xi Jinping advocated for 4 propositions. So how is China doing in these 4 propositions? And what about the WHO response? We will have DG Li to take the question. Thank you for your question. It's my first chance to take part in the press conference. May I take this opportunity to express my sincere thanks to your long-term interest and support to global health. At the moment, the pandemic is spreading across the world. It is now affecting more than 200 countries and regions in the world. This pandemic once again alerts us that virus respects no border and no country can be immune from the disease. So it is indeed a pressing task to join hands and deal with the pandemic together. On March the 26th, President Xi Jinping took part in the Extraordinary Leaders Summit of G20. He put forward many important propositions on behalf of China. I think one of the most important principles is the community with a shared future for mankind. This has provided a strong impetus for global cooperation. NHC is earnestly implementing President Xi's advocacy and focusing on the following aspects. We've done the following things. First, intensifying the international cooperation, and we support the G20 to share information, conduct a policy coordination, and have international cooperation. We have been actively engaged in organizing the G20 Health Ministers meeting, actively engaged in drug and vaccine R&D, and cross-border international cooperation, also helping the countries in need to deal with the pandemic. And second, we have strengthened the coordination to deal with the pandemic with the various mechanisms like the China CEEC, China ASEAN Plus 3, China Arab Union, the Shanghai Cooperation Organization, etc., to intensify information sharing. Thirdly, we have information sharing and technical exchange. We've already set up the International Cooperation Expert Panel, and such a pool of experts have enabled us to conduct more than 40 video conferences with more than 100 countries and regions. There's such a great need for these video conferences, and in the coming week, we're going to host another 20 video conferences like this. And fourthly, we've supported the leadership of WHO. WHO is the most authoritative and specialized agency of the global health. It plays an important leading and coordinating role in dealing with public health emergencies. After the outbreak, WHO has made great efforts to coordinate the global efforts against the pandemic. Recently, China donated $20 million US to WHO to help WHO to improve coordination and, in particular, to support the capacity building in the weak countries. We've also sent experts to take part in the WHO's efforts to develop technical guidelines. We support WHO to continue to play its core role in dealing with the pandemic, improving the global health governance, and better safeguard global health safety and people's health and well-being. Thank you. Thank you. Let's continue. On the left, on the second row, the second gentleman reporter, please. Thank you, DG Mi. With this CRI, epidemiological survey is extremely important, but it also needs the coordination and support from the general public. So how can the general public support epidemiological surveys? We will have we will have Dr. Feng Luzhao to take the question. Thank you for your question. Epidemiological survey counts on the general public to provide accurate and reliable information, which is also the due obligation of the citizens. Epidemiological surveys will help us to identify the close contacts, quarantine them, and conduct relevant measures to prevent the potential spread of the epidemic. Epidemiological staff or epidemiologists will protect people's privacy. So you just need to rest assured that your information will be secured, and we will never disclose such private information. Also, for epidemiological surveys, we need to work with the relevant staff from various social organizations and institutions like hotels and etc. And we are making our due contribution to global health and public health. Some cases or some patients may try to hide from the epidemiologists their whereabouts or their relevant information, causing the potential risk of pandemic spread. So it is every citizen's due obligation and responsibility to cooperate with such surveys. Thank you. Let's continue on the right, on the second row, the first reporter, please. Thank you. With the Hong Kong Economic Herald, at the moment, globally, we can see the pandemic is accelerating the spread, and for people who are traveling inbound, are there any standards for the home-based quarantine or the concentrated quarantine? And what about the risk of the pandemic spread? We will have Professor Wu Zhunyou to take the question. Thank you very much. You've put forward a very good question concerning the inbound travelers. We advocate that there should be concentrated quarantine, and we do not support the home-based quarantine. Let me explain to you the reasons. As you can see, some inbound travelers may not have developed the symptoms, and they may develop symptoms during the quarantine period. Once they develop the symptoms, actually they've already caused the spread or transmission. So if they were taken as the home-based quarantine, then they will inevitably had contacts within the families. And we've already learned that for people in the incubation period, the transmission occurs even if the symptom has not developed. So even if you adopt a very prompt measure and identify the symptom and send the case immediately to the quarantine or to the clinics, it is still too late. So previously, we had the home-based quarantine, but later we found the disadvantages or weaknesses of such practice. That's why we now decide to have the concentrated quarantine for inbound travelers. And these days, we've already summarized effective measures, and we have the capacity to screen all the inbound travelers and provide quarantine services to them. Also, once we identify the potential cases, we can quickly apply the control measures. So this can prevent the social spread of the pandemic and will not lead to any potential resurgence of the cases in the society. Okay. On the left, on the third row, the reporter in white, please. Thank you. With the health news, my question is about the asymptomatic cases. I noticed that on the day before yesterday, relevant information was disclosed by NHC.
Are there any effective countermeasures for asymptomatic cases? What will be the future measures to monitor and quarantine asymptomatic cases? I'd like to ask Madam Wang Bing to take the question. Thank you for your question. Currently, the reports, epidemiological survey, close contacts related to asymptomatic cases are basically consistent with those of confirmed cases. Health institutions at all levels, upon identification of asymptomatic cases, must be reported within 2 hours online. Within 24 hours, the epidemiological survey on the asymptomatic cases must be completed. 14-day mass quarantine is to be carried out for asymptomatic cases. 2 consecutive NAT test negative result can release them from the quarantine. These are our management measures to step up the monitoring of asymptomatic cases. We need to step up targeted monitoring. We expand the coverage to the cases themselves, the potential close contacts, the key groups, and the proactive screening over the close contacts. We will also give play to the role of fever clinics and communities to trace the source and close contacts, improve the testing sensitivity, identify the asymptomatic cases, and exercise mass quarantine. We will carry out epidemiological survey over asymptomatic cases to trace the source and disclose information transparently. Thank you. Next question, please. Journalist from the 4th row on the right side. Thank you. With Xinmin Evening News. The academic community has different opinions on the transmissibility of asymptomatic cases. Some believe they may trigger a new wave of transmission. How pathogenic are these patients? I'd like to ask Wu Zunyu to take the question. That is a very challenging question. Thank you for putting it forward. Asymptomatic cases are cases. They are infected with the virus. They are tested positive with the NAT test without clinical symptoms. Can they pass on the virus? Will that lead to another wave of transmission? Shortly before, the Infectious Disease Journal published a paper online which was conducted by the Ningbo CDC on the close contacts of confirmed cases and the close contacts of asymptomatic cases to compare the onset of symptoms between these 2 groups of close contacts. The findings had 2 important signals. First, on average, 1 confirmed case can pass the disease on to 3 other people. On average, a symptomatic case can pass on the virus to 1 patient, 1 person. Or in other words, the transmissibility of a symptomatic case is 1/3 of that of confirmed cases. So this is based on individual comparison. Then let's look at herd analysis. The cases that have got infected from asymptomatic patients only take up 4.4% of the total infected cases. Or in other words, if we analyze group-wise, the transmission from the asymptomatic cases is only small. This was the study done by Ningbo. In other provinces, similar studies were carried out. There was another big cohort study in another province among 1,500 citizens. The close contacts of asymptomatic cases, and 7 out of the 1,500 had the onset of the symptoms. Further analysis showed that These 7 cases did not only contact the asymptomatic cases, they also contacted confirmed cases, so it could not be determined that these 7 cases were caused by asymptomatic cases only. If we want to come to the conclusion, the close contacts of confirmed cases can be the more appropriate subjective under our study. So we need to define it very precisely to decide on the transmissibility of asymptomatic cases. The available data is still quite limited. More study and observation need to be carried out to understand better the transmissibility of asymptomatic cases. But one thing I need to remind the public is about the cause of asymptomatic cases. 2/3 of the asymptomatic cases may develop into patients. Or in other words, 2/3 of the asymptomatic cases were patients in their incubation period. All the asymptomatic cases must have had contact history with confirmed cases, or they may have visited the epidemic hit region. The new confirmed cases, for example, in some free areas, symptomatic cases do not come out of nowhere. Our ability can control the transmission from asymptomatic cases. It is fair to say that asymptomatic cases will not lead to a second wave of transmission. Thank you. Next question, please. Journalist from the 5th row on the right side. Thank you. From South China Metropolitan News. Some worry that the occurrence or transmission in African countries may be disastrous. What are the support provided by China to African countries? Thank you. I'd like to ask DG Li Mingzhu to take the question. We pay special attention to the epidemic spread in Africa. We have been active in providing assistance to African countries. At our best, we have given play to the role of African assistance medical teams. National Health Commission has a history of sending medical assistance teams to Africa for 57 years. We have 1,000 plus experts working in Africa. After the outbreak of the COVID-19, these medical teams have played a good role of residence country. A medical team, 250 trainings have been carried out, 10,000 plus local health professionals have been trained, 800 plus notices have been circulated to cover African people and Chinese nationals in African countries. Great achievements have been scored. For example, the medical team from China has organized local training to improve the identification, diagnosis, and treatment capacity of the local health professionals. We also collaborated with the health authorities, the representative office of WHO in communication. The medical team assisting Ethiopia helped the Ethiopia Health Department and completed PCR testing kits. Adjustment and calibration, so that apart from South Africa, Ethiopia became the second African country with NAT test capability. We've also carried out experts communication. We have set up remote expert assistance mechanism and provided technical exchanges with 54 African countries, provided needed technical guidance timely so that African countries can get the support of quality medical counseling. We've also supported the disease control centers in African countries. We have a permanent counselor in African disease control centers, and our expert has been engaged in long-term assistance, providing valuable suggestions. African countries say Chinese experiences are of great reference to them, and they have been thanking us for our support. In light of their needs, we will continue to provide assistance at our best so as to improve their response capacity to COVID-19 and contribute our part to the safeguarding of global health security. Thank you. Next question, please.
On the right, on the third row, the third lady reporter, please. Thank you. With the cover. My question is about overseas imported cases and the related case. Previously, in Guangzhou, Zhejiang, and Beijing, there were such related cases arousing a lot of concern in the society. So how to understand these are related cases, and do they indicate any potential gaps in our epidemiological survey? And how about the risk of a resurgence of the cases? We will have Madam Wang and Dr. Wu to take your question one by one. Thank you. You mentioned the related cases to the imported cases. Actually, they are the secondary cases of the overseas importation. These cases have had close contacts with the imported cases. One reason for such related case is that in the early days of our prevention of overseas importation, in some provinces, for people who travel inbound and who were from the low-risk regions, the customs quarantine found that they were not any of the 4 categories of the high-risk populations. So, namely, they were not the close contacts of the suspected cases. So they were allowed to take public transportation and went back home. They stayed at home for home quarantine. So they may actually have been in the incubation period, and they may have also been the asymptomatic cases. So for such secondary cases, most of them were identified in the home-based quarantine and also in the public transportation, and they have caused some cases. So we have been alert against such cases, and now the localities in China have strengthened the further control and the screening on the inbound travelers. We've already developed a fairly proven procedure. So for people who have to travel between the countries or who are engaged in the international businesses, all of them should receive such border quarantine and the screening. As for further epidemiological surveys, I think Dr. Wu will give you the answer. Thank you. Okay, your question also reminds us that we do have a fairly well-developed monitoring and the screening system so that we can quickly capture these cases. The high-quality epidemiological survey is of critical importance to identify the close contacts and the potential infected cases among the close contacts. For high-quality epidemiological survey, we emphasize the fast speed and the reliable result. If there's any missing cases, then this may cause to further spread of the infectious disease. So for epidemiological staff, it is requested that they should be well cultivated, well developed or trained. They should have fairly good communication skill with the target population, like the inbound travelers. They should help the particular target to remember correctly and accurately their whereabouts and try to avoid any potential missings. So with such a fast and comprehensive survey, you can see that this has put forward more requests on the epidemiological service staff, and also we need to quarantine these people. And I think it is fair to say that with the arrangement from the NHC, and epidemiological service in China have been improved, and now we can ensure that our epidemiological service can play a critical role to identify these asymptomatic cases. Okay, on the left, on the fourth row, the third lady reporter. Thank you. With CGTM, with CRI. Now we have dispatched expert teams to other countries. Could you please elaborate on their work overseas? Also, we are very concerned about their self-protection and their health when they work abroad. What are the measures adopted to ensure their health? We will have DG Li to take your question. Thank you very much. And also, thank you for your deep concern about the health and the safety of the expert teams. Previously, when China was at the most difficult time of epidemic control, we received broad support from the international community. Now the situation domestic situation is improving, and we relate ourselves to countries and regions which are affected by the pandemic. So under the overall arrangement of the State Council's Joint Prevention Control Mechanism, recently we have sent expert teams to Italy, Serbia, Cambodia, Pakistan, Venezuela, the Laos, and etc. The expert teams are developed by NHC, and the experts are selected from the related provinces and municipalities. They cover fields like public health, clinical diagnosis and treatment, and psychological support, as well as TCM. The major tasks for the expert teams are to conduct cooperation and exchanges with the local health administrators, health institutions, and experts, communicate epidemic information, share prevention and control experience, and also develop all kinds of professional and technical training and provide counseling and guidance. They have also provided support to the local Chinese and the Chinese students study in those localities. The experts teams have been well received by the localities. In Serbia, the expert teams have been received and met by President and the Premier of the country, and for 2 times they have been invited to the commanding centers meetings. Serbia has highly commended the expertise and the professional capacity of the expert team, and their opinions have been well adopted. In Cambodia, Premier Hun Sen advocated the expert team's work in the social media account, and in Italy, the suggestions put forward by the Chinese teams have been highly commended by the Italy side, and the expert team has also coordinated the relevant video conferences and technical and professional exchanges. In Pakistan and Venezuela, the expert teams are also working actively with the health authorities and the institutions. We also pay great attention to the health and the safety of the expert teams. When they work abroad, they work directly under the local Chinese embassies and consulates. Before they were dispatched, we signed relevant legal documents with the relevant country governments, identifying the roles and responsibilities, and ensuring the health and the safety of the expert teams. Also, we have equipped the expert teams with adequate self-protection materials and supplies. We constantly remind them to strengthen self-protection, so please rest assured that their health are guaranteed. Thank you. Let's continue.
Journalist from the fifth row on the right side. Thank you. With China Daily, we've learned that previously experts called for the antibody epidemiological survey and NAT-based survey. What is the difference from the current survey? Do we have such plans? Thank you. I'd like to ask a researcher from Luzhou to take the question. Thank you for your question. COVID-19 as an emerging infectious disease is understood limited by us. We still have quite limited knowledge about its pathogenicity and transmission spectrum. In the previous stage of countering the disease spread, our survey purpose was to identify the cases and control its transmission. Our major way of survey was on-site survey plus laboratory testing, plus the disinfection on the contaminated environment. All these previous measures was to ensure early reporting, early identification, early quarantine, and early treatment, and put the asymptomatic cases and close contacts under medical observation to minimize the risk of transmission. Currently, we have basically stopped domestic transmission. In typical places, we began to carry out sampling of the serum testing and conduct tests on antibody. This will help us to understand the herd infection and disclose the post-infection transmission spectrum and have some analysis and forecast on the future trajectory to work out the future vaccination policies and prevention control measures. It is learned that the serum-based epidemiological survey has been carried out in certain regions. Thank you. We can take two last questions. Thank you, journalist from the third row on the left side. A journalist in lattice. Thank you. With China.org on 26th of March, when attending the G20 summit, President Xi introduced that China has established a COVID-19 online knowledge support center. What was the background of setting up such a center? I'd like to ask DG Li Mingzhu to take the question. Thank you for your question. Shortly before, National Health Commission, along with the World Health Organization, organized China Experience Sharing International Briefing. On that international briefing, we shared the latest diagnosis and treatment protocol, a whole set of technical documents, and the entire meeting process. Deliberations and discussions were uploaded to the COVID-19 Online Knowledge Center. In this center, you can find prevention control strategies, diagnosis, and treatment protocols, and all these have been the achievements from our experiences. They have withstood the tests of reality, and we reserve nothing when disclosing this to the world, and this has been well received. This online conference were received 100,000 online viewings. President Xi therefore mentioned this online knowledge supporting center on the G20 summit. Apart from these documents, on this center you can also find the sharing of experiences by renowned experts, including Professor Wu Zunyou's training, some of the training video conferencing, the latest research results, and health and science knowledges. So on this knowledge center, you can access China's experiences, technical standards, and technical guidelines. We have a dedicated team to dynamically update this knowledge center. This knowledge center is in nature a database of knowledge, a rather static one. Previously, I mentioned some video conferencing with experts, but we also have some medical teams providing assistance to overseas countries. So this knowledge center, in combination with the technical guidance we provided, while technical assistance teams have provided experiences to the rest of the world. Many countries say that China's experiences have reaffirmed their confidence in winning the battle against COVID-19. Thank you. Next question, please. With the China News Service, up till now, medical observation has been targeting at different groups. What are the specified measures adopted on different segments of target audience? Some public may feel anxiety when they were put under medical observation. How can we support them psychologically? I'd like to ask a researcher from Luzhou to take the question. According to the existing protocol, 4 groups of people have to be brought under medical observation. The first group is the asymptomatic case. They should be put under medical observation for 14 days, and 2 consecutive NAT tests negative results can release them from the medical observation. Confirmed suspected cases and close contacts of asymptomatic cases should also be put under medical quarantine in medical observation in mass quarantine. When conditions do not allow, they can also have a home stay observation, starting from the last contact with confirmed suspected cases for 14 days. If the suspected case have been removed from suspected cases, then the close contacts can get out of observation as well. Third group of people that should be put under medical observation are diplomats, and the third group are all the inbound travelers apart from diplomats and the other engaged in important business and academic exchanges. They must be put under medical observation in mass quarantine. The fourth group of people that should be put under medical observation are the discharged cases. After discharging from hospitals, they should be put under medical observation for another 14 days. The purpose of medical observation is to manage potential transmission source, prevent further transmission of COVID-19. Therefore, accepting medical observation is the legal obligation of every citizen. We are still at a special unconventional timing of prevention control of COVID-19. It is necessary to be rational, reasonable. Even when under medical observation, we can still contact our families and friends through phones or social media. The interaction with family members and friends can alleviate the psychological anxiety. The keeping of a healthy lifestyle and a healthy life tempo can also help to improve resistance. Thank you. Guest speakers, tomorrow we'll focus on science and technology innovation and supporting resumption of business operation. We'd like to have officials from Ministry of Science and Technology and other departments to take questions. With that, we conclude today's press conference. Thank you.